I declare this access road well and truly open.
Let's let it be the first car through.
A good clap.
Hey. Under a clinical services review that highlighted major significant problems with the hospital. They wanted to remove the beds for the hospital, and a campaign was formed to show that the community really wanted to keep the beds. And we were successful in keeping the beds. On the back of that, it's incumbent upon us really to look at the significant problems with the hospital and see if we can mitigate them. And access being one of the major problems, achieving this project has dealt with that problem of access. The guests were brilliant. We've had Her Majesty's Lord Lieutenant Angus Campbell, who came and opened up the access. Our local MP, Simon Hoare, came and said a few words.
The access road is hugely important, because access and egress to the hospital was one of the issues which the CCG had highlighted as being problematic when they were consulting upon the future of the hospital. And the Friends have wrestled with that, they've raised the money, they've solved the problem. And that's going to be a huge benefit to those who are working here, to patients getting for appointments and the like, and also those who are visiting.
Important to get this access business sorted out, but we're also celebrating really the other issues that the community are dealing with all around the site, which were criticised in the original for the original consultation. It was the care of the surrounding area, so that it made it pleasant for people.
It's the largest financial project we've ever done, as far as I'm aware, from the 1920s when we were formed. So it's a big day for us. The cost of a new hospital down here is probably about 30 million. So it's an awful lot of money. And being the smallest community hospital in north of Dorset, I suspect we're last on the list.
Our community hospitals, particularly in rural areas, are so vitally important. They take pressure off the acute sector. They provide a very useful health hub in the middle of our communities. So I think it's another way of underpinning the importance of the hospital here at Shaftesbury.
Not that in the middle of the night I got flu. I mean, not the sort of thing people call flu, but real flu, and it just lasted 2 weeks, and then I was having difficulty breathing. But it was, just the sort of lung problems you get, but it was getting quite serious, and I had to come in the middle of the night to get treated, and it was there for me.
Well, we've still got two other projects that we need to formally open. One is a mental health unit that we have brought into the hospital grounds. Really, we bought a house 2 years ago now. We converted it for clinical use, and the Steps to Wellbeing mental health team now operate from there. So that was our first major project. This one being our second. Last week we finished funding on our appeal that's run for a couple of years for a wheelchair accessible electric vehicle. We got the final 10,000 in last year, so we can celebrate that now. So there's a few projects that we're just tying up.